Here. So, shalom, good evening. This is TMS Roundtable Global. We are live streaming from Israel, streaming from
Rhode Island,
East Coast, and West Coast, California. And I couldn't be happier on a Monday night. It's either Rose or I. Rose is in Australian Melbourne, and it's the middle of the night for her. So we are switching half the month. Sometimes we're together, but this is number 100 and maybe 61 broadcasts weekly for 3 years since COVID. I called Michael Galinsky on the phone and said, we got to do something. We got to help people. And he said, you know what? You got a great idea. Call this woman Rose Hoy in Australia. And that's how this all started.
Wow.
And we are very blessed to meet amazing people. And let me just introduce tonight our guest. Laura, I met you, our good friend, Dr. Bethany Rains, I think was speaking about CRPS on a certain Facebook page. And I kind of followed her and I went to this other page, which is a positive CRPS, helping them with some kind of, it's not the typical Facebook page. I forget what it is. We can put it up here. And you were on it and you were talking about some kind of healing. I think that was it. And I, like a bee like honey, wanted to get your name. And then we emailed.
I think it started with the virtual reality, and Rita commented on the virtual, and I responded back to Rita.
Yes.
And we just joked about it. It sounds awesome. I'd love to try it. It would be fun, but it's just not that accessible. But we're just we're interested in that whole dynamic of the virtual reality.
Right. And then I just want to, for the listeners, so we have had Tamara on the show only twice, and this is the third, and it'll be more. Her and Rita, they're wonderful fans and incredible supports for Rose and I in the TMS Roundtable. And Tamara has recovered from CRPS, wrote a book called Defying the Verdict, has a website that called Defeating CRPS. And she's spoken with Dr. Schrubener on podcast about this work and about the brain. And so we are here to discuss it. Laura, I want to hear about your story. And at any point, maybe Tamara and I might chime in. So we have a little bit of a discussion. Anybody in the audience that wants to ask questions, please in the feed, ask your questions and we'll answer. So Laura, when I saw you discussing with Rita, who also recovered from CRPS, who works with Tamara on their website and their blog, Rita La Barbera. And I saw that you had a recovery story, and I contacted you and you were happy to talk about it. So sort of from day one, you're living your life. Everything is fine. There's no trauma. There's no injury. And you have a car accident, correct?
Yes. A backstory is a very stressful job, home care, physical therapy, rushing from one patient to another, daughter that just went to college, my only child, and she has type 1 diabetes. So my focus on her for the previous 18 years was like laser focus.
Wow.
While working full time, and then all her activities and, all the things like the work life stuff. And then I was driving along to another patient's house and I got rear-ended by a drunk driver at 11 o'clock in the morning. And I woke up in the hospital and I was there for 2 months with rehab and everything. And I had a lot of injuries, a head injury, a spinal cord injury. But the bones I broke were the right upper extremity, all the ribs in the front and the back, the scapula and the clavicle.
Wow.
And we talked about it in physical therapy. And I think this is one of the reasons I had such fear with my diagnoses, because in 25 or 30 years of being in physical therapy, I saw one patient with a broken scapula. And we would say, well, who breaks their scapula? How do you do that? Like, it's such a hard bone to break.
Strong bone.
Yeah. So when I broke mine, I'm like, the fear already was set in my brain. Like, oh my God, what happened? So I just had this vision of the truck. I was in a little tiny like Honda Fit type car, and I got hit by an F-150 pickup truck in the back. So it was not like an even an even fight. It was, he just took over. And I just pictured it in my head of the truck like slamming into the right side of my body. And
I mean, you had a picture in your mind already after
yeah.
you're already still imagining, you're still back in the past. You're like
waking up from the in the ICU and hearing everybody talking. Oh, can you believe it? The guy was drunk and he hit her. His engine was in her back seat. I'm listening to all this stuff, not even conscious, because I had so much propofol and Versed and all that, all those lovely drugs that they give you in the ICU so you forget. But it was going into my brain, all these negative things,
wow,
like, this is a terrible accident.
wow.
I don't know how she's going to ever walk again or do anything. And so that,
Whoa, we got to be careful. We got to tell these nurses to be careful.
yes, it was the nurses.
Little Rose hears that.
It was the nurses, but it was also like my family, my family members were
You
like,
were aware of these people in the recovery room at the day of your accident, and you're still remembering. This is the first thing you're talking about.
the first thing. And I still smelled the burned rubber because he pushed me like down the road because he was so drunk that he didn't even wake up when he hit me. He just kept like pushing my car down the road. So I smelled that burned rubber smell in my nose for probably a week or so. It just wouldn't leave my brain. Everything. I just started to realize that this brain is really in charge of everything good and bad.
That's not you. So you recover. So you're in the recovery room, and then tell us what happens then. Then you're in a lot of physical therapy.
Yes.
They tell you have broken bones, but broken bones heal.
Yes, all my broken bones healed. And when I started to get the pain from the CRPS, it was horrific. And
Wait a second. You were healing in the hospital.
Yes.
Anyone come to talk to you about your emotions, your fear, your sense of well-being? Like it was just continue.
We have social workers come in, but they try to work on the whole picture, not just the psyche of the patient.
Okay, right.
They were trying to, I remember the social worker trying to get my daughter to withdraw from the semester. And if I could have shot up in bed, I would have, because there was no way she was going to take time out of school because she's in a program that has to be done. So I didn't want that. So that was stressful.
Okay, so a lot, enormous stretch. I mean, you're in a hospital. So, okay, so Laura, who diagnoses you with CRPS? Because you're healing from broken bones from a car accident, 3 to 6 months, body's healing, you're in physical therapy, you get in the water, you're back, you're walking, you're healing. Bones heal, nerves heal.
Bones heal. Yep.
Muscles heal.
4 years later, I got diagnosed with CRPS. So this, between the time of the accident and the 4 years, all my bones healed, my head injury healed, my spinal cord injury is an issue. I still have that, which is called central cord syndrome. It affects the upper extremities more than the lower. So I'm a walker.
This was affected in the car accident.
Yeah, my neck. Yeah, it level C7.
T1.
Yeah. Yep, exactly. So the nerves that are affected are the arms and the hands mostly. So they're limited, they're weak. But the right side, I didn't have any movement at all, and it swelled up really bad. And I had the blotchy skin and the red and the pain. And I went to my spinal doctor, who I wouldn't think that he would know much about CRPS anyway. He was like, oh, it's just normal pain from your accident. It'll be fine. And then when I kept complaining, he sent me to an upper extremity orthopedic, a couple of them, a physiatrist, a neurologist, and none of them even mentioned CRPS at all. They just said, oh, it must be your spine, because everything, I guess they were more concerned about the spine, because I was supposed to have ribs plated because they were so broken in all these different places. They decided to let that surgery go because you can only do it within like 48 hours or you can't do it anymore.
Okay.
So they said, we need to focus on the spine. So everything became about my neck.
Okay.
All this pain is coming from your neck. You had a neck injury. You had a spinal cord injury. You're going to have pain. It's normal. I heard this for 4
And
years.
when is it going to end? I mean, pain, people heal. So
And
were
I
they?
thought the level, because I worked with patients that have had neck breaks like mine and surgery fusions, and they had pain, but it wasn't anywhere near the pain that I was describing.
You taking a lot of painkillers?
I did for about 3 or 4 months. I was on the oxys. I got off of those, and then I was on Lyrica, which I was on that up until the 4 years when I was diagnosed with the CRPS, and then I tapered off of Lyrica,
Okay.
and I was so glad I did because I felt so much better. My whole body just felt better being off of that drug.
So at some point, you're not healing normally, quote unquote, time. You heal, you go to physical therapy. This is not your path. Wasn't going that way.
No, and I did heal. My whole body felt like it had healed that 6-month mark up to a year. And that was great. And the physical therapy was great. But even she didn't understand why I had so much pain. So everyone overlooked my right extremity. They just said, it's coming from your neck. They did a repeat MRI, repeat CAT scan, EMG. Everything came back the same as the day of the accident. So they didn't see anything new. They thought something would show up. They did a chest MRI and the brachial plexus was fine.
This is amazing to hear. Amazing. So at some point somebody says something else is going on.
I think it was me that finally said there's something else going on, because no one, even to this day, I would love to go back to some of the doctors and tell them, hey, all that pain was CRPS. And I don't know how I could have walked into an upper extremity orthopedic specialist with the sight of my right arm the way it was, and them not even think, oh, maybe it's CRPS or RSD.
Yeah, but I want to ask Tamar this, and I want both your opinion. CRPS develops from the injury. It's the injury first, it's the trauma first, it's the neural pathway first. Then CRPS develops from the brain path. Go ahead, please tell me.
There are 2 types. Okay. And I was very lucky because I did not have a precipitating injury to blame for. So my path through healing was much easier than Laura's because her whole body was injured. And so they did have reasons to go down the rabbit hole. In my case, it was so obvious that it was something else.
Yeah.
And so for Laura to make the connection first that there is something else, not the injury, and then believe enough that it is all in her brain. I'm not saying
right, right,
because it's a different connotation.
No, but she had a car accident, and then her body didn't heal in the quote unquote normal times.
But it's more common. Yeah.
And then her brain starts to create this relationship. I'm not going to get into the details, but that, and then on top of her healing injuries, she has now a neurological, what would you call it? CRPS is a neurocircuit. I mean, I'm not going to call it, what would you call it? You developed from the accident CRPS.
I called it, it's a brain, it's a pain or a disease that originates in the brain, even though it started in a physical sense in the body with the right upper extremity. It turned into a brain problem, and it's the same exact way that phantom limb pain happens. Exactly. Because you can, because I have no sensation at all in my arm at all. The back of it, not zero. I could get burned, I could get cut, I would never even know. So my husband would say, why do you have so much pain when you can't even feel like a feather on your arm? And I was like, the same reason people have phantom pain. And I did work with patients with phantom pain, and I didn't get it. When I was working with them, I had no idea. I didn't know why, because the stump would heal, the structures, the ligaments, tendons, bones, skin looked great unless it got infected. It would look great. So I would be questioning, like, why do they have so much pain still? And it was because it was coming from their brain. Their brain still thought that the limb was there because the nerves just get cut, like a live wire just gets cut, and it's angry, it's mad, it's like, where's the rest of my limb?
But I want to just ask, and then tomorrow I'm going to let you talk. You have a functioning right arm. It's functioning. You can do anything with it, but it's a little sensitive. It's a little hyposensitive to touch and
it's not
sensations.
fully functioning. It's kind of, it's been a long road, and I have definitely brought it back to semi-functioning. My hand had never had any function in it at all when I developed the CRPS. So what I have now is a grip, a mild grip. As far as the sensations go, the wind used to hurt me. The air conditioning used to hurt me. It's not like that anymore.
Okay.
That's all calmed down. Even physical, like if somebody touches my arm, it's fine.
So that's recovery from CRPS.
Yeah.
That's that ability to handle normal sensations because the brain is not, reacting.
I calmed my brain down enough to realize that the things that were happening weren't dangerous. And the only way I have the pain now is when I'm stressed out, or I'm thinking about a future event, or I'm, trying to do too many things in my head at once. Like, it needs to be in the present moment. If I look too far into the future or the past, my CRPS.
So your arm is a barometer.
It tells me, like, whoa, like, slow down.
It's a pain meter. We call it like a pain meter.
Yeah, and it doesn't have anything to do with the weather or exercise or any of that.
So go ahead, and then I like the linear. So you get CRPS, they diagnose you, you realize it's something. It's you're healing from your car accident, but now there's something deeper happening that you have to look at, and tell us how you began to heal. Did you go through the medical model, and what turned you on to mind body, and how you met Tamara?
Okay, so I started the Curable app. That was step one, the Curable app, and doing all those exercises with the psyche and your past traumas, and I started to think, wow, I really was primed to getting this condition, chronic pain in general, CRPS. Wow. When I look back on my childhood and all the things that have happened in my personality, like Tamara said in the past, I definitely was primed to be this patient. So I said, I guess this is the only way out. I stopped going to all my doctors, and I don't recommend that. I still go to my primary care doctor once a year. But all of my orthopedic doctors, they said, you don't need to come back. Like, I don't know why you keep coming back to me. I don't know what to do with you. One doctor said, why don't you get a medical marijuana card? They had no idea what to do with me, none whatsoever. So I said, I guess I'm on my own. So I figured out Curable was a good way to start. And then
what brought you to, because some people, like, there's enough CRPS people that think I'm a witch. When I advertise on their Facebook pages. So what brought you to this mind body science? That's what brought you to it. Who and what? I'm curious.
Well, if you're on Facebook and you follow certain pages, Curable app is right there advertising. So I thought first few times I saw it, I was like, oh, what's that? But then I finally looked into it.
Okay. So you were searching and you were not buying into the symptomatic kind of, let's talk about symptoms and let's see whose symptoms is worse, which is very sad.
I had to leave that.
Okay.
Setting. And that was the best thing I ever did, was to leave. And I feel so bad, and I really hope they really find relief, but I could not be in those forums anymore. So I came upon Curable through Facebook. I started it. And then from there, I dove right in, which is my personality as well. I dove right in. I started to do all the things, the meditation, the exercise, the sunlight, just taking care of myself. And I had a book cure. I read Dr. Sarno's Mind-Body Prescription. I felt great for a couple of months, and I thought, oh, I'm great. I'm fine. I'm better. I'm cured. But then the pain came back. And that was when I realized, I guess I have to go deeper and do more of this psychological work and trauma in the past and figure out why things happened the way they did. And, forgiveness is a huge thing. The self-compassion is a huge thing.
I just must stop. And Tamar, tell me, this is science. This is, I have to say over and over again, we are not here to talk about New Age. And I'm not against New Age, but we're talking the science and art of healing. And it is the brain. And like Rose will say, it's the road from the head to the heart. And, love does heal. And you'll see Dr. Fred Luskin on that movie talking about forgiveness, Dr. David Hanscom. And these are my teachers. And, because what is love and awareness? It's chemical. It's a relationship.
Exactly.
It's a relationship with yourself. And it's hard to have a healthy relationship and a loving relationship with yourself when you're in pain. So Tamar, say something to that. When you're in pain, when you're scared, just give us an insight. How do we find a way in when we're full of fear and full of symptoms?
So I see it all the time. The biggest obstacle to healing is doubt and inability for self-compassion. And I include forgiveness into self-compassion. So people refuse to believe that what they have is of psychosomatic nature. And the doubts, they creep in many ways. And I'm hearing things like, oh, I do agree it's all psychosomatic, but this has to be physical because it hurts so much, or it has to be physical because I have this EMG results. It has to be physical because I broke my foot 40 years ago and the pain disappeared, but it came back. So it's got to be physical because I did something to my foot now. And so it comes in different shapes. And doubt is really, I'm not a healthcare professional. I'm not a neuroscientist, but I do believe that doubt has underlying anxiety beneath it. And anxiety triggers that pain circuit. And so for as long as you are in that loop of anxiety and loop of a doubt, you will be back into the pain. And then on the subject of self-compassion, when I first read about self-compassion, I thought, well, I'm not into New Age stuff. My background is in math and science, and, just give me a break. And then I realized, and it was interesting because someone told me, why are you talking about your brain with such a hatred? And I said, well, I'm not talking with a hatred. I'm just, I'm really trying to encourage it. No, you are talking about yourself with such a hatred. And I started digging into self-compassion and something about forgiveness that I arrived on after months of thinking about it. People have deep psychological traumas from the past, and they keep coming back to it. And they say, how can I forgive such and such person all the harm that they did to me? And I understood what forgiveness is. Forgiveness is not a permission for that person to do what they have done to you. Forgiveness is a permission to yourself to put it behind, find energy and strength, and move on. And that, I think those three components is what really gets you out of the hole.
Yeah, and I just want to, I continue to look at this and study it because it's, for me, I want to find words that are more layman's words. But again, these core emotions, doubt is run by fear. Fear is processed in the same place as pain, sadness, anger. And when the brain perceives these, it protects you. I mean, we are being protected by a brain that's being given messages. So the brain is doing its job. But as we say, the brain is an organ that needs to do its job. Help me digest, help me rest, help me breathe. But if it's getting these other messages to protect me with inflammation, and enormous inflammation. I mean, what is CRPS? Enormous inflammation, enormous creation of a blockage of movement. I mean, I can't even imagine what's going on in there to affect all the nerves at the level it does. And it starts in the brain and it ends in the brain. The compassion and the love part has to come from the unconscious and the heart, which, it's another broadcast, but it is the science and it is a brain, and like Stribner will say, let's go back to the brain. Let's think psychologically. And all the doctors know this. This is not something new to the medical doctors, and we're not going to bash them. They do an amazing job. They save lives, but this is not their main purpose to see you in their office and say, so what else is going on in your life?
They're specialized in body parts.
Body parts. That's what we did.
Body parts.
Yes.
And Laura, I really want to commend you for, you're a physical therapist. You are conditioned to see the whole person. My CRPS, I was diagnosed with CRPS by my physical therapist. I was sent to her for RSI because that's what they said, carpal tunnel syndrome, RSI, which I didn't have RSI. And she looked at me and she said, well, I think what you have is CRPS. And why? Because she was trained to see the whole person. And that's the biggest problem with our modern medicine, that everybody is specializing in like small little thing. They dig very deep, but it is a small part of a human being.
Yeah, well said. Well said. So tell us, Laura, so you read Sarno, you had a little book, Cure, which unlike the word cure, God cures, but you had a lot of shifting in your symptoms.
Yes.
You thought, great, I'm recovering from CRPS, and then it came back. Why would it have returned for you?
I don't remember what was going on at the time. I think it was just maybe a little bit of the doubt crept back in, and I said, what if it is a structural problem? It came back in my head. So that little bit of doubt, I think, was what made my brain freak out, if you will, and start to send out more signals. And that's when I read Tamara's book, which was very informative. It was an excellent book, and I could totally relate to her. And I emailed her and I asked her about the self-compassion and the meditation, because that's what she said was really important. Two things that I probably, didn't really think that would work, but they do work. They do. And it just calms whatever can calm your nervous system down. And I invite anyone to just try anything, any modality that they think is going to calm their body down. Some people it's Reiki, some people it's meditation or yoga, and see how they feel in that moment. And 9 times out of 10, they're going to say they feel better than when they're thinking about the shopping list or what they have to do next week. So I thought, wow, this is really true. This brain does not like to be in one place or another. It likes to be calm. So when somebody has this type of injury or pain, you really need to calm everything down.
So, okay, so that's amazing. So now you're reading Tamara's book. And so you're now in a habit or a pattern of taking care of yourself, of knowing what your triggers are, and you're in recovery. And whenever you have your sensations rise, you'll know, something. Your arm is your barometer. But would you say that you have CRPS, or you have you're like, how would you describe yourself, or how would you, like, you're like, I don't want anyone to think we heal, because I'd like to say, and Rose taught me this, I mean, your symptoms are coming from your deep feelings and your anxieties. And so it's partly where your body's reflecting your emotions. That's kind of where it's reflecting it. So this is now the place where your mind, this is the place where you reflect your anxiety or your stress. It's in your physical body, but you don't have to be, we can have stress and anxiety and problems and not have it expressed in our physical body, by being in touch with your emotions, by being connected to your emotions, by understanding the mind body. So can you talk about that a little bit, both Tamar and Laura?
Yeah, I think a lot of people say, oh, it has to be structural because of all the swelling and the pain, the redness that they get at the beginning. I would have definitely, at the beginning, I wasn't diagnosed, but I definitely would have met the Budapest criteria because I had all the signs. They're all gone now, so it's in the past, all the physical signs, but it's still the same process. Like, those physical signs were present because my brain was so worked up. It sent all these signals, blood supply, the nerves follow the blood vessels. So it started to send all these signals to the area that was injured, and it still thought it was in danger. My brain thought that my right upper extremity was still in danger because I had these internalized feelings of all the talk that went on in the ICU, of all the negative things that happened. And, well, I hope she gets to work again and, do what she wants to do. So, of course, I had these ingrained feelings. So even though the physical signs are gone, the pain still is there. But I have to say, it's never because I overdo it with any kind of exercise or a food I eat or the weather. It's because I have a stressor, and that is it. The only reason, it's because my brain goes into danger mode at the slightest bit. I'm still working on that, because that's why I say I'm still in recovery, because I can get out of pain and be out of pain and have it really, really nice. But then if I think about something that my brain may be like over anxious about, then I get the pain.
Wow.
I definitely get the pain.
Wow. What about that, Tamar? What about the ongoing sort of process that once you have this, I mean, I don't want anyone to feel a prisoner, because a lot of people say, well, I know I can heal, but what if it comes back? And that's the other level of doubt.
Mm-hmm.
So
the way I look at it, most of us own cars, and for the car to function properly, what do? You take it in for maintenance, right? You don't want to lose your teeth. You go to the dentist and you just go for a regular checkup, and you go and you get maintenance work done on your teeth, right? Why can't people accept that they have to do maintenance on their nervous system? Why do they feel that they can do whatever to their nervous system and not pay for the consequences? So I think it is very important going forward to take care of yourself. And I know that, I become cavalier about myself, and I start sleeping less, and I start not taking care of myself psychologically. Maybe I stop meditating. Maybe I get loose with my yoga practice, and boom, a small stressful event throws me off balance. What do? Well, I sit down, I meditate, and I'm fine. And people ask me, because in the book I write how I was meditating at least 1 hour every day. and someone asked me, oh my God, do I have to do it every day for the rest of my life? No, I cannot do that. I better just go back on Lyrica. And I said, no, you just have to stick with meditation for several months, and then you just normalize, stabilize your nervous system. And then I meditate. My meditation now is to pause in the middle of the busy day for 2 minutes and bring myself back to myself. It's more of a mindfulness practice versus meditation. And on occasion, when I feel it's not enough, I just sit down and meditate, and it happens maybe.
So you know yourself. You're checking in. You're checking in with yourself. And guess what? If you don't check in with yourself, your symptoms will tell you. So the symptoms are telling us. Check in.
Yeah. Yes. A year ago, I had a stressful situation. I was worried about something. I was stressed out. Guess what? I started feeling neuropathy in my foot. And I thought it was it was something else. It was like pain in the toe. And I thought, well, it's got to be bunion. It's got to be, some kind of a neuroma or whatever in the foot. I went to a chiropractor. I spent $500 on chiropractor sessions. And then as soon as the stress was gone, the pain was gone. And I thought I knew everything about TMS and everything about psychosomatic pain. And it caught me by surprise.
Right.
And so now I'm more mindful about when my foot starts giving me signals. I go, well, you know what? I probably need to calm down a little bit.
Yeah.
That's it. That's what you do. Maintenance. Just remember, you take care of your car, you have to take care of your nervous system.
Yeah. No, great advice and great explanation. So Laura, for the listeners, give us a little bit of a list, a little bit of a laundry list. And by the way, I just want to respond to something. Every time we breathe, every time we take a deep breath in, and my clients, like, they hear this, it's like just, this is my Greek choir, like breathing. And every time we breathe in and we let the air out, we are creating our own cannabis, our own Lyrica, our own heroin, our own cocaine, our own opioids. We are a pharmacy inside with just our breath. And I didn't even talk about the vasovagal system, which is an incredible nerve. So we have complete control over that. Correct me. I feel like we have complete control over that, partly through our breath and our awareness. And, so that's an incredible tool. The breath, the present moment. I mean, these are just incredible keywords, to respond to your symptoms rather than react. And even if we do react, I say, then respond to that. There's a way out, like Alan Gordon will say, just by the awareness, by the knowing yourself. And you're both talking about that so well, how you came into this not as a young child, as an adult, and you have a life behind you, and then this happens, and it's like the Joe Dispenza work, which I love to read about, is like, you had to sort of recreate a new part of your personality, that it had to evolve this way. And the wake-up call was your car accident. The wake-up call was Tamar's injury. And so this is how we can use our trauma and drama of our life to serve us. So all that to say is, share more about some of the insights that are across the board. It's not for Laura or Tamar or Tova. These are the things that will help any brain, because it's studied in research and science. So share more about some of the things that you do, or your go-tos now, that will help you get back on track.
Well, first of all, the second that you do get the pain back, the first thing you don't want to do is have the fear, but you are normal and human. So your first reaction is going to be fear. But I think your second reaction will be, all right, what am I going to do about it? And my guru that I listen to all the time, and this is another side note, but it was an epiphany of mine, because after I went down the rabbit hole of mind-body methods, I had an epiphany that I realized that I had not been overeating in the past year and a half. And it's not that I lost a ton of weight, but because of the walking every day and not emotionally eating like I used to, because when my brain is calm, I don't need the food to calm me down. And this was things taught to me by Lisa Schlossberg, who's a licensed social worker and a health coach. And her mantra is, when you feel an emotion or a pain, if it's a physical thing, it may be uncomfortable, but it's not unsafe. It's almost like Alan Gordon's saying of, you got to tell your brain that it's safe.
Look through a lens of safety. You got to see your body through a lens of safety. Yeah.
Yeah. So Lisa's mantra is, you might have a feeling, it's definitely uncomfortable, but it's not unsafe. And that is such a huge thing that when I do get the symptom, I just tell myself, all right, it's uncomfortable, it sucks, but it's okay. It's not going to kill me. My brain is fine. You just have to calm it right down. And that's when you need to do the things that bring you peace, which is the breathing, the walking outside, go outside, the chemicals that you talked about in the brain that we can harness by, early morning sunlight and the cold exposure. There's so many things that we can do. And you have to try them all and see which ones that you like.
Different times of the day or week, one may not work. Yep. So there's that doubt thing, like don't give up, because it is a brain, and you are in control. You are the navigator. Yeah. So what would you add to that, Tamara? What would you add to that list?
So something that comes from the observations by Dr. Sarno and other TMS doctors like Dr. Schubiner or Dr. Mosley, people who end up with psychosomatic pain are the ones who tend to have a tendency to overreact and to catastrophize. Our reactions are not very typical reactions. We are on one side of the spectrum. And that's what I remind myself, that, when I have a certain emotional reaction, a negative reaction, I need to bring myself back to the center, to that middle, because maybe I'm estimating the danger. Maybe I'm catastrophizing. And that little mental adjustment makes me calm down. And I go, well, it's not that bad. It's not that dangerous. It's my tendency to overestimate the danger. And so that really helps me to stabilize emotionally, and to add to the definition of negative emotions, that they're not unsafe. Emotions really are a kind of a flush of hormones through our bloodstream. There are specific chemicals that get released into our bloodstream with emotions. So if we suppress those negative emotions, we actually forcing the body into discomfort, and that eventually will result in pain. So it is easier to feel your anxiety. It is easier to feel your fear, and really find some physical expression of it. I know that when I'm anxious, if I let that negative emotion kind of roll down my spine, 2 minutes later, I'm okay. It's extremely unpleasant, but if you let it be, it ends in 2 minutes. If you don't, you will have the reaction of chronic pain after. So why not? And then eventually you realize that those negative emotions, yes, they are unpleasant, but the more you let yourself live through them, the less unpleasant they become. And then there is one more, and I'm pretty sure, Laura, that you recovered because you absolutely had something to live for. You had your daughter who you needed to support, who was just beginning college, who needed to be on her own without your help, and you needed to be there. You had your family, you had your career, you had something that took you away from your pain. And that probably brought you recovery.
Yeah,
Well,
you have to have that
no,
goal. Yeah.
it's it's hope, it's belief, and this is also chemical. But I want to address another important question. I mean, look, there are people that are so struggling and so suffering, and I do believe that suffering is a choice. I do adhere to some of the Buddhist principles, and I think suffering is another conscious mindset, and suffering is relative. And I'm not one to, I've not been in chronic pain. I've had autoimmune things. It doesn't matter what I've experienced, but there are people in excruciating pain, and I think I would like to hear from you, because I heard Shrubiner. I listened to your podcast with Shrubiner and the director of This Might Hurt, Precious Light Woman. Anyway, and he's like, we the fear of the pain happens. We have the fear, and then the cycle begins. So right there and then, if we could understand the fear pain cycle, as he says, we can somehow witness, observe, recognize, accept something there, and slow down that cycle. So I would like to say that we are in control of the pain, the brain pain. And if you're taking medication and smoking marijuana I don't care what you do to reduce the pain, please do, but get to the cause, get to the fire. This is what this is about. Let's get to the cause. And with CRPS, there is a cause, and it's from the brain. And there are people healing from CRPS. But when someone is in excruciating pain, how can we support them from the place that they're at for them to break the cycle so they can even begin to do what you two were so courageous to do? And they're courageous as well. They're courageous warriors, but we're not here to beat something. We're not fighting a battle. We are meeting ourselves. So can you address that? When someone is in excruciating pain, how could they maybe benefit from your advice?
Well, I think it's what you said. Do whatever you can for the pain relief. And that's, Alan Gordon says it all the time. It's when whatever it is, hot packs, cold packs, whatever, hot bath, do all those things. But then when you can finally take a breath, say, all right, knowledge is power. And even though I learned about the brain and anatomy in school, and I learned about the body, but the two connecting, that didn't click with me. So I dove back in and, not so much the anatomy, but I learned about the brain and how it interacts with the body. And it really does run the whole show. None of our organs would function if it wasn't for our brain. And it's like Tamara said about how you have to keep the car running and the dishes going. We have skin. We have to take care of our skin, our eyes, our teeth, all that. So the nervous system is like such an important system because it runs everything in our lives. And if we don't have a regulated nervous system, everything else becomes so much more complicated. So that would be my first thing. Try to find relief however you can, and then learn as much about the neuroscience. And on layman's terms, there's so many good books out there that are just regular old, Laura Mosley, Adrian Lau. They just explain it so well, how we feel pain and why we feel pain. You just have to fill yourself with knowledge and read books like Dr. Sarno and Tamara's book, that it so explains it all right there. And that's
David Hanscom.
Excellent.
David Hanscom, amazing book, Back in Control.
Yeah. It's not just about backs, it's about everything. And he podcasts about every autoimmune disease and his threat safety physiology. In fact, Oy. Wow. My internet keeps going out. Are you there?
Yes.
Anyway, it's my internet, something amazing. It's unusual, but thank you for your patience. Dr. David Hanscom taught me enormous amount about threat safety. And, you know, for the listeners, he's a spinal deformity surgeon where I ran on about him as well. And he does podcasts weekly with so many autoimmune stories. So again, CRPS is an autoimmune condition. The body's attacking itself. And it sometimes has a very good reason. And the body's attacking itself because it feels threatened. And you brought up some beautiful, you know, you kept referring to threat and to safety. So I appreciate that language. It's beautiful language. If we could, he wanted me to change the mind body title to threat safety, which is kind of interesting. So thank you for tomorrow. And I didn't mean to interrupt. So Dr. David Hanscom, you said you were talking about him, and I interrupted like usual.
No. You absolutely. He said everything I should have said about Dr. Hanscom, except one. He stopped doing spinal surgeries and switched from very lucrative and very money-making business to doing TMS work, which doesn't give him much money, but he feels full satisfaction as a professional.
Yeah, and again, I mean, and he'll come on the show and he'll be like, I'll be like, I don't want to bash doctors. And he's like, no, we got to bash doctors because they're not uninformed. I'm like, they're doing their job. They're doing the best they can, but they do help us and hurt us. Just like our rabbis and our priests and religion gets about, you know, like it's just about we need to take the best from, and we need to be responsible. This show and you ladies, and this is a great way to round up. Like, we are here to educate. We are not here to sell, to promote. We are here to educate. You decide. This is the way doctors should be. Come into my office and you decide if you want to go to physical therapy, exercise, nutrition. You decide. But this is where the patient should be getting choices, not told what to do, but choices.
On the subject of bashing the doctors, I just want to say that our modern clinical medicine progressed. If you look back like a couple hundred years ago, it progressed from wearing a bird's beak to scare away the plague, and operating on basically assisting in women in labor after dissecting corpses, cadavers, and then infecting them and killing them. It made a long way to where it is now, but it doesn't mean that whatever is the last word today is the last word tomorrow. Medicine evolves. Neuroscience was in the crib 40, 50 years ago when Dr. Sarno started his very lonely quest, right? And so he couldn't even explain in the modern neuroscientific terms his ideas because there was no foundation for him. And what Dr. Schubiner or Dr. Mosley or Dr. Hanscom can explain now is based on more modern science. So to expect that medicine will not evolve in the next 10 years, I can see in 7 years that I have been in the middle of the CRPS and chronic pain story, I can see there is a shift. It's almost palpable. People talk more about psychosomatic conditions, and it pains me to go to all the CRPS forums and hear people who talk about amputations because their limbs are so deformed and so painful. And then they end up with, obviously, phantom limb syndrome, right? And people who refuse to even hear the word psychosomatic because they think that if it is all in my head, that means that I'm crazy. And so I think the tide is shifting, but still there are so many people who need to be convinced.
Mhm.
And I think the first people to start with should be doctors. But unfortunately, some of them are very stuck in the today knowledge of medicine, and they don't want to look ahead. Like my beloved Dr. Schubiner and Dr. Hanscom.
Well, guess
And
what? More and more doctors are getting TMS and
yeah, yes,
psychophysiological psycho psychophysiological disorders and stress illness, as Dr. Clark names it. And
yeah,
so many more are receiving it because of their lifestyle, because of sometimes the ego, because of their own trauma, because of their own overuse syndrome. And it's bringing them around. So it's happening. And thank you for this, because it is happening. And I'm on both ends of it, as a patient, as a doctor of this.
yeah.
I try to relate to everyone and not and come in from a more humble point of view. And and God willing, in the future it'll be part of the medical system, part of the health insurance system. This will be paid for, and there's more and more coaches and great therapists out there. I mean, you gave Laura all this free advice. Tamara, you're like Mother
Mhm.
Teresa.
Yeah, she
You
is.
know, I can tell you that watching all these discussions on CRPS forums about the how to get another brain implant, or what to do when you are addicted to lyrical, side effects of all the from all these drugs, or how to get the doctor to give a referral for amputation. It terrifies me so much that I really feel that I need to continue. And the occasional emails that I get from people like Laura, who say, thank you for the website. I'm so glad I found you. I, I'm so glad I found your website. It just makes me continue doing it.
Yeah. Yeah. And Laura, did you want to say something?
Well, the thing is with the doctors, and we all say most of them are great, and most of us patients, 8 times out of 10, we heal from our injuries and we go on our merry way and never to be
Yes,
seen.
exactly. And many CRPS people have not gotten to the CRPS because they've healed. So yes,
Right.
thank you for
So
saying
yeah, the doctors that do deal with people like us don't know, and it's not their fault, but they don't know how to deal with us. So they just keep passing the buck. Oh, go see this guy, take marijuana, do what you need to do, give you more prescription. So they don't know how to deal with it, because a lot of doctors and other professionals, they stand to lose a lot of money because a lot of people will say to me, well, how come my doctor or my therapist hasn't mentioned this kind of work? I'm like, well, if they did, we wouldn't need them anymore. And we would need them for acute emergency situations, but chronic pain, we wouldn't need them for chronic pain anymore because we would know how to fix it. So they don't want you to find out how to fix it.
Well, unfortunately, our society is so intense emotionally, and progresses so rapidly into the world where brain is disconnected from the body, because so many people live in that virtual reality world and they forget that they have a body. And so there will be plenty of work for the doctors going forward. And we definitely need more TMS psychologists like Dr. Tova and Rose.
Yeah.
And we definitely need more awareness. And that's what really makes me go back and put another entry in the blog on the website. Good. And do another revision of the book so people would just know, and they would know that CRPS is not the end of life.
No, and to the doctors and all of us, and to the look, and on the record, if somebody's body can create CRPS, that's a pretty incredibly strong, powerful nervous system. And I always say, use that. It's the opposite of that strength that can heal you. Because strong and sensitive people get these kind of very severe reactions in their brain. And I want people to see the power of what their body did, and the doctor in them, and the pharmacy inside of them, and the therapist inside of them, and the ability to love. I mean, if anyone, so don't get me started here, because we need to wind up. But I really want anyone who's listening, and I'm going to put this on TMS Wiki. Forrest gave me permission to do that, and I'm going to spread this out because it's an amazing testament to the power of the human body. I mean, really, really. And I'm honoring both of you, and I'll invite you again, because, when it comes to like the 1000th show, I think, I'll need to just invite you guys back and repeat, because we're repeating the same thing each week. The body keeps the score. The body can heal. The mind and body are intimately connected. You have a doctor inside of you. Let's go and learn how to make our own cannabinoids. If we just hug for 2 minutes straight, we can create oxytocin. We have created this condition. It did not come from something external, and your body can heal it. And anyone who's listening, Tamara has CRPS, Defeat CRPS. It's a website. You can reach her through me, through my show. She's been a lot on my Facebook page. Laura is probably an upcoming wonderful coach yourself. You're going to make a great coach.
Absolutely.
Laura.
Thank you. Well, I do teach a workshop, a chronic pain workshop. We don't delve enough into the neuroscience, but it is a pain management self workshop. I do like a group virtually,
Amazing.
But eventually I do like a one-on-one counseling.
Amazing. Wonderful.
Amazing.
Wonderful.
Yeah. And considering that you have such an extensive knowledge of human body from your profession, you would make a fantastic coach.
Yeah.
Thank you.
Yeah. So think about it. Tomorrow and I will train you.
I can't train you. I'm not a coach.
You would also tomorrow. You're ready. You're doing it. You're doing it. You're doing it. Like I'm telling you, the doctors and all of us, the therapists and all of you. So I appreciate you. Go ahead, Tamara. You want to say something?
If I could add something, please. Yeah. On one of those Facebook groups on CRPS, I posted a question: how much effort, personally, emotionally, physically, you would put in to get rid of CRPS? And people said, oh, I would do anything to get rid of CRPS. And I told them, talk to me, direct message me, and I healed, and you can too. How many people you think reached out to me?
How many?
0.
What?
0. Wow. I had several dozen of responses that they would do anything. 0 reached out to me.
Wow.
And this is another
whole show. Gave up on themselves, and this is what keeps me going with this. Yeah. I don't get paid for any of it. The proceeds from the book pay for maintenance of the website, for hosting the website. But it infuriates me that patients and doctors accepted the dead-ended status of CRPS.
Yeah. Well, this is you using your sadness and passion to serve others, and in the end, it's keeping you healthy because you have a purpose, and it is feeding me in some way as well.
It
So
does.
somebody has a question. I'm so happy we're still here. Let's answer it.
Somebody,
I was told that I have CRPS of the
back.
pelvis and low back, pudendal nerve decompression surgery. I have limited mobility and pain with movement. Does this sound congruent with your experiences? I have fear of pain, but fear of disability. I need to hold on to hope. I'd love you both to address that. Sarah's, because she's new. Sarah's new on my show. So thank you, God. You address that, both you of you?
Laura, you want to start first?
Sure. I mean, if you think about it, whether it's the brachial plexus nerves or the pudendal nerve or the trigeminal nerve, they're all coming from the brain. So I still think that it could definitely be something that can be helped. And it's almost like when somebody reaches rock bottom and then you say, I'll do anything. And I don't understand why nobody responded to you. But that's where I was at rock bottom. I said, I guess I have to live with this pain for the rest of my life, or the second option. So there was nothing to lose. It didn't cost me anything. I mean, nominal fees with Curable and some book purchases. But other than that, it was my own work. And just the fact that we know so much more now with all these functional MRIs, and they know that the brain does have these areas that feel physical pain, emotional pain, all in the same area. The limbic system, which is the midbrain, holds all our memories and emotions and trauma. So when you have that going on, I think it's worth it to just try to delve in and learn about these mind-body techniques, because it will help every single condition, I think. No matter what the nerve is, where it originates, I feel like it's going to help people that have overactive bladder. I mean, I'm not speaking as a health professional in this. I'm just speaking as a person that has witnessed it. People that have all different kinds of conditions, it's helped. So that's how I feel about it.
I can only second that, because I was told absolutely, with absolute certainty, by a neurologist, by a surgeon, by whoever else, that the nerve in my hand was damaged, and the only way to deal with it was to do a surgery and whatever. And this is the hand that could not move. And this is the hand that is totally healthy now. And I totally agree with Laura. You have very little to lose and very much to gain, because this kind of approach, this kind of therapy doesn't have any side effects, except you will be a better person after, because you will find that you're much stronger than you thought before. It is really a personal growth journey when you start taking on this kind of a cost to overcome the condition that is deemed irreparable. And then what was moving me a lot was I was absolutely hell-bent on proving my doctor wrong. And I did.
And I want to add to that, Sarah, you expressed your fear. And remember, fear, you can channel that fear. We're not telling you to get rid of your fear or to lose your fear. Fear is an emotion, a feeling. It is energy. We're not going to go there, but fear is something that's driving your brain to create more inflammation. So you can keep it simple like that and say that to understand your fear, accept your fear, journal about your fear, be mindful about your fear, embrace your fear, have compassion for your fear. We're not saying to get rid of your fear, but understand your fear of pain and your fear of disability is causing the exact thing. So the brain is listening to your unconscious mind. And so simply understand you're in a place like a holding pattern, and that you can shift that. And there are methods that we've learned. I'm certified in pain reprocessing therapy, which is helping you see your body through a lens of safety, to understand your fear and to know that your body is experiencing a perceived threat. Yes, CRPS might feel like a threat to your body, but if you can understand that the pain is in your brain, you can have a relative point of reference. And there are ways to again, I don't know your situation, so I'm not going to speak anymore. But the fact that you came on the show, you're expressing your fear, and the hope is chemical. The belief is chemical. You can rise to a level in your brain where the fear and the pain, you see, they're all being processed in the brain. That's what I want to say. So the pain is an emotion. And if you can understand that your pain is an emotion, and I can send you some science on this from Dr. Bethany Rains, then you can understand that it's just being processed in the same place as your fear. And I know it's not easy to feel the fear and do it anyway, or knock out pain. It's not, some people do that. Dr. Schubiner talks about talking to your brain. Let's get back to this, Sarah. If you can have a relationship with your pain, if you can somehow understand your fear on a level and learning a little bit like what we're talking about here tonight, you can calm your nervous system down. I've seen it happen with CRPS people. We're seeing it happen here. So Sarah, you have a lot of hope right in this virtual studio. You can contact me. You can talk to Tamara. You can get, I have 3 or 4 other YouTubes with Tamara and Rita talking about it. I have enormous amounts of research about healing chronic pain. CRPS is just another form of chronic pain. And it is congruent. Whether you have CRPS or chronic pain doesn't really matter. I'm not dumbing down your symptoms, but the symptoms are secondary. Let's go to your brain. Let's go to the cause of what created such a hypersensitive, again, Laura and Tamara, I mean, such a hypersensitive reaction. I mean, Laura explains about her fear of the accident, the memories, also some childhood stuff she didn't talk about. Tamara, we didn't need to talk about your childhood. You obviously were prime for some wake-up call. And so Sarah, I know this is deeper, but some of my clients, they start to look at their pain as a message that they're not being attacked. What is the message? How can they benefit? How can they be served by this situation? Okay, this is higher evolutionary, but this is where we go with it. What is my purpose? What is the purpose of this happening? Why did my body do this? My body caused it. My body can heal it. And I can go on and on like a sermon on a mountain. But Sarah, I'm happy to talk to you. I give complimentary consultations. I'm happy to share with you these insights. So please be in touch with us. And I'm really happy you spoke up. And
yes, yeah. If we could heal, you can heal too. Convert your hope into faith.
Yeah.
Into faith in yourself.
Absolutely. Wonderful. Mm-hmm. Okay, my lovely ladies, my dear friends and colleagues, I am just honored to be sitting here. And thank you to the internet that it only went in and out 10 times and not out completely. I don't know what's going on with the heavens and the stars here in this part of the globe. But anyway, ladies, till we meet again.
Thank you, Dr. Tobin. Thank you,
Tamara.
Yeah, we'll be in touch.
Okay. Best of luck to you. I'm so proud of your achievement. After such a terrible injury, you were able to recover, not just physically, but also mentally.
Yeah. Laura, thank you.
Yes. Thank you.
Okay, we'll be in touch.
Be in touch. Okay.
Have a wonderful rest of the day.
You too.
You too.
Bye now.
Bye.